erectile dysfunction is a problem that affects many men, and especially as they grow older. Not because of testosterone, but actually the reason why is because of vascular disease. Because the penis needs blood to get to it, and the blood vessels going to the penis are tiny. In fact, they're smaller than the coronary arteries, the arteries that supply the muscle of the heart. So if you think about it, if someone has coronary artery disease, for sure they have erectile dysfunction. Because if they have clogged up the arteries going to their heart, they must have clogged up the arteries going to the penis before. In fact, erectile dysfunction is a sign, foretelling sign of coronary artery disease. So let's say somebody has coronary artery disease and erectile dysfunction, and now with erectile dysfunction, they have exhausted all the previous treatment modalities. Or let's say, for example, they tried medical therapy, it didn't work. Initially it worked, and now it doesn't work anymore. And they tried injection therapy. Initially it worked, and now it doesn't work anymore. Well, there is another treatment modality, which is surgery, that allows someone to still have erections despite having failed all other treatment modalities, and it's the penile prosthesis. Believe it or not, the penile prosthesis has existed forever. It's been here for a while. So it's actually, it has a very high satisfaction rate for those who have it, and it's not a new surgery. It's been there forever. So what is it? Well, when I first found out about the penile prosthesis, I was actually shocked to find out that this can be done, but believe me, it can be done, and a lot of people have it, and you wouldn't be able to tell just from looking at it from the outside. But this is what it is. The penis is made up of 3 compartments. 1, 2, 3. The first 2 is called the cavernous body. The bottom one is the urethra. Okay, the bulbous spongiosum has the urethra in it. But the first 2 are the cavernous bodies, and they're basically, the best way to explain it is actually think about a bicycle tire. A bicycle tire has the outside, which is rubber, and the inside, which is the air chamber, right? So the air chamber, you can take the air chamber out and you still have the bicycle tire. But the bicycle tire on the outside, that big thick rubber, well, that's not what provides that's what provides the maximum, the maximal volume, if you will, that the bicycle tire can take. But the pressure is actually coming in from the inside, from the air chamber. Okay, same thing for a penis. In a penis, you have the cavernous bodies, which are analogous to the outside of the bicycle tire. Okay, and on the inside of the penis, there is basically like a sponge material that when it fills with blood, that's actually giving all the pressure. So if there's not enough blood going in, the procedure is basically to insert what is analogous to an air chamber, okay, inside the penis, except it's not air, it's water. So basically, we make a small incision on either side of the penis into the cavernous bodies, and we insert an air chamber like thing that basically is the actual prosthetic itself. It's like a balloon-looking, long, elongated thing that fills up with water, and we insert it inside the cavernous bodies. Okay, and now this thing can either be filled with water or emptied of water, and the water itself goes into a reservoir of water that sits on the inside of the body, and the way that you circulate the water in or out of the prosthetic is through a pump that sits in the scrotum. So it's like having a third ball, like if my friend calls it the third ball. So you take that third ball and you squish it 3-4 times, and by squishing it 3-4 times, it gets the water from the inside of the body from the fluid-filled reservoir, and puts it right into the prosthetic, which is sitting right inside the penis. And this prosthetic, which is like an air chamber like we talked about, goes from being completely deflated, i.e. a completely flaccid, limp penis, into a fully rigid, erect penis by insufflating the inside, what's sitting on the inside of the penis. And the only thing is, first of all, I should mention that you might think that the sensation gets impacted, but it doesn't. Actually, the man still retains full sensation of the penis because the nerves that innervate, okay, the skin and the outside of the penis are completely independent from those that innervate the inside of the penis, which bring the blood into the, into the penis. So even if someone cannot get an erection, they still feel the outside of the penis. So those nerves that go to the outside of the penis, they still are intact. So even with a prosthetic, the man retains the ability to feel, so for sensation as well as orgasm. And also more, but also importantly, it is to mention that the glans penis, which is that triangle on top of the penis, that is not impacted by that prosthetic, because that actually is an extension of the urethra tissue, which is basically the bulbous spongiosum. So the bulbous spongiosum, when the urethra are not touched, that has pluses and minuses, because if you think about it, that tip of the penis will never be affected by the prosthetic, so it will never get actually hard. Some people take Viagra with the prosthetic in order to get that tip hard, but by and large, if it's not working, it's not working, and if Viagra is not working, then that's not going to be working. So one of the problems that that someone might mention is that, well, the tip is not getting hard. Yeah, the tip will never get hard because that actually is part of a different compartment of the penis, that third compartment where the urethra is actually going. Okay, but overall, the prosthetic does have a very high satisfaction rate because it gets the job done. You can get an erection on, whenever you need it. You don't lose sensation. You still retain your ability to get orgasm, and it always works. The only risks, after getting a penile prosthesis are, risk of infection and risk of erosion, but those are rather small. If that happens, then you'd have to get the penile prosthesis replaced or removed. This is a preliminary video about penile prosthesis.